And in what scenarios do you insist on a biopsy, and what do you ask? What do you ask your dermatologist to specifically? Hold on a second. Let me restart that question. In what scenarios do you insist on a biopsy, and what should people really consider when they're thinking about biopsying a patient?
So there are more, I guess, life-threatening, not guess, life-threatening forms of psoriasis, erythrodermic psoriasis, where it's more erythema all over the body, removal of skin is shedding. Um, those are life-threatening, should be in a hospital, you're going to biopsy and make sure that you haven't missed anything. Is it like a drug eruption like Stephen Johnson versus erythrodermic psoriasis? That definitely calls for a biopsy after you've put that person in hospital, of course, to be seen. Pustular psoriasis also has, and not just the palmar pustule, the pustule all over. Also, I would call for a biopsy if it doesn't respond to treatment. And I would start off with going how much body surface is there. You can start off with topicals, oral by anti-inflammatory medications like methotrexate, cyclosporin, or oral prednisone. And then, of course, there are biologics. So you would start doing that. But if there's no response, then yeah, you should do a biopsy if you're not a dermatologist, because most dermatologists can pick up keys on psoriasis. But if you're not sure, it's the easiest tool you have in your armamentarium.
Mhm. So let's talk a little bit about assessing severity and deciding, if the psoriasis is hard to treat. Practically, how do you decide whether a patient is a topical only patient or needs phototherapy or should go straight to systemic or biologics beyond the rigid PASI or BSA cutoffs?
Yeah, that's always usually what they want, especially with insurance companies. But to be honest, you're looking at your patient. What's their quality of life? You can have people who can't pick up things with their hand. I wouldn't stop at a topical immediately. I'm like, you need to start applying for biologics, and that's something you should take in consideration, or treating with them an oral on first consultation. People who are depressed don't want to be intimate with their partners because of the psoriasis, the flaking, or not wanting to go to school because teenagers get psoriasis, children get psoriasis as well. So you have to look at, I think you take everything into consideration when you're thinking, how do I start proceeding? I do start proceeding with topicals for everybody because you still have to get things covered for people.
Mm.
But if it's more severe, if it start to, especially infringe on quality of life, you start putting in the orals and the biologicals right there and then.
Mhm. And when it comes to applying for a biologic and getting things covered, tell me a little bit about what that journey is like and, what hurdles patients have to jump to get there.
So, and I understand the cost of these medications are in the 30,000s for the year. So most insurance companies are a little bit more cautious going, are you just going to put them on, stop them? We're giving them this medication. Well, you should have a dedicated staff that does prioritization. You usually have to do a step process. What did you give them first, doctor, before we jumped into this? And that's when they do look into BSA, the body surface and surface area, to make sure that, am I covering enough? Is it severe versus mild? Um, but that dedicated person and being persistent about applying for it is how you get that medication covered.
Mm.